Hello, this is Muhammad with M&M Institute. Today we are going to discuss about perfect OET writing structure that will help you to get your 400 plus in writing. So on screen, as you can see, there is a structure of writing. First is the date can be written over here or maybe over here, right? That is followed by the address part. Then we have the recipient name, followed by the patient name, the subject line, right? And not only that, we can see there then on screen appropriate structure of writing. This is your purpose of writing, followed by the expansion of the case notes, and this is the further expansion over here. Let's say expansion, and this is socioeconomic history as per this letter, the request or the further plan that has to be done, and the sign of statement and this salutation. So you can see this was a general overview of your writing task. We'll further discuss in detail. I just have been through this letter quite quickly to show you what would be the ideal structure. So you can see we have the marking criteria on screen. The organization and layout is important element in structuring the letter. Remember that there is no standard structure. However, following thing, as you can see on the screen, that should be followed. That you must have a logical paragraphing. And in those paragraphs, the layout, or I mean to say the sequence of the paragraph should be as per importance, and you must have a clear focus as per the reason of writing. You must highlight the important points. Highlight means to bring it up. You should not mask the information that is significant and important in your structure of writing. And this document, the letter, should be well organized document, and the information should be organized as per the importance of the sequence. So importantly, as you can see, the paragraph or the letter can be divided into structure, and we can make like the subsection as per the priority and importance. So on screen, as we can see there, we have the letter on screen right now. So let's discuss in detail. Over here on screen, as you can see, first of all, we can write down the date, right? Then the doctor name. From these notes, you can write it down, transform them, followed by the designation if it's given, then the hospital address, and so on. There is no comma over here. Remember that. You should memorize this structure. There is no gap actually. That's being there just because of the thing that we just pasted. Anyhow, that is followed by the recipient name. You can write it down the second name over here, and subject line, and is the age or date of birth. As you can see right now, this is the layout part, and it's a standard irrespective of type of letter that you will be writing. This is a conventional or a standard pattern that should be followed in each and every letter. And in organization and layout, that is a part of the criteria. If you want to get a good score and you don't want to miss anything from the layout, so one of the things that we discussed with you right now, how to structure your date, where to write down the date, address, and the recipient name, it should be memorized so that you might not miss or do any mistakes, right? So this is, sometimes the student asks this question to put comma over here or not. So basically, if you are writing a comma over here, it should be written after your sincerely or faithfully as per the formality. Now we can see the letter. Now you can see, I can show you the case note first. This is the case notes you will find in the description of the letter as well. The case notes for the discussion purpose. A quick review to the case is, we have the differentials. You can say that it's a medicine letter actually. We are suspecting it to be AMI, like acute myocardial infarction or acute pulmonary edema. This question mark means that we are suspecting something. Along with that, the patient has been having worsening of asthma. So what the situation is, the purpose of writing is to write this letter to the emergency registrar, and for this tentative diagnosis, and you can see in the plan paramedic transfer, it's a kind of transfer letter. on an urgent basis or kind of emergency letter. So you can see and learn from this letter, although you must be flexible in your structure, but still you will learn how would you have an appropriate or a proficient structure in writing tasks. So as you can see in this case, quickly speaking, we can see there, if you can see quickly, that we have multiple visits. In the first visit, the patient is here with mild chest pain and asthma and so on. Then again in the second visit, he is having mild chest pain, asthma worsening. Then on so on, you can see that we have mild chest pain, asthma worsening, and we have scheduled the review after 2 weeks. Ischemic heart disease was confirmed on exercise tolerance test. Then you can see in the last visit, that is the most important visit, where the patient had sudden onset of crushing chest pain, and then you have ECG finding positive, and based on that you had made an assessment. So going back to the letter again, and we can see the structure. So you can see that the purpose of writing, we should mention clearly the reason, like why are we writing this letter. It must be quite clear in your reason of writing. You can see that we referred this patient with suspected diagnosis of AMI or APO. So two things. First is AMI, second is APO is being mentioned in the letter. And along with that, we have mentioned the worsening of asthma. So at least we have a clear reason of writing in this introduction part, right? So in this way, your introduction is quite important. It's the purpose of writing or the reason of writing that has to be clear in your writing task. So as you can see in this letter, at least we have mentioned that why are we writing this letter for. That is followed by the expansion. So students are quite confused in an emergency referral letter, that should we start from today or should we start from the progression of event chronic. So basically I would say that you have to be flexible. Here you can see in this letter, we started with the recent history, today's consultation, followed by the sudden chest pain, then ECG finding. So in the very first line, you have given the whole complete picture of the event that is related to the cardiac event. This whole paragraph, we just covered the cardiac event, and here they have discussed about the pulmonary things, right? So you can see, even I can just change the sequence. Like here you can see, we can change the sequence. The second line you can write at first place, and first line you can write in second place. Within the paragraph, you can see change the structure. You can change the sequence. It does not matter. Why? Because you can see the focus remain the same. We are focusing on the chest pain. So in this line, the first one, they are discussing about acuteness, like acute problem or the severity of the symptom in the first line, right? And the second line is the summary of your previous visit, like multiple visit patient do have, and he was having mild chest pain. So all these things, including normal ECG, right, and ischemic heart disease was written over here, followed by the pulmonary event. So in this case, you can see we have given in first line that his asthma has been worsening, right? So it will give you a picture from the very first visit till now, there is a worsening of asthma. And the reason was he was not compliant to the medicine due to the alcohol dependence, right? And we can see there that is a recent finding for the pulmonary things we have written over here. And again, with the oxygen saturation and so on has been written in this letter. Now this paragraph belongs to the socioeconomic details. We have compiled all the information: packed cigarette smoker, businessman, family stress, and then alcohol consumption, counseling, and so on. And the last is the, we can say, a conclusive paragraph where we do mention that why we are referring this patient for. Actually, we are transferring this patient using the ambulance. It will give, like an impression that it's a kind of emergency referral letter. And when the management that has been done, when you are referring this patient by the GP, and then your sign of statement, yours sincerely, and then you can write down doctor, but leave one line. So I believe that this video will help you out to understand the structure of writing. More important thing that I would like to discuss is, again, I would suggest you not to follow any structure or do not implement this structure of all the letters of emergency. You must be flexible in your structure. Identification of the case notes, selection of the case note, I would say, or organization of the case notes will dictate you that how would you structure your writing for. So this letter will help you to understand the organization or the best possible structure for the writing. Stay tuned. M&M is going to help you out to understand the basic of writing structure, either it's nursing or medicine. In the next video, you'll see one letter, a model letter response by the M&M team for nursing. And yes, we have a lot of options available. One of the best possible extensive and intensive course globally nobody is offering in the price that we are offering for. You can take classes for 3 weeks. You do have an option to take one grand mock on every Friday with a comprehensive feedback response that you can see right now on the screen. You can see this is a feedback that has been documented by our M&M in-house team. We have a group of doctors who are working in our examination department. Nobody globally do have such extensive team working on your exam paper, give you a quality of the feedback that will help you to ace your writing. Not only that, we do also have a speaking feedback services. Right now on the screen you can see this speaking feedback has been written by our examination team, led by the doctors, listened by the doctors, written by the doctors. So yes, indeed, it's extensive package. You can see that in our program, you do join us with classes followed by the 20 days extensive practice for mini mock. Yes, if you can see and attempt this mini mock session, this will give you your profile of performance. You do have a profile. You can discuss with us in a graphical form. We can show you that where you are standing. At the moment you are standing on this point, and this is the time you can book your exam. So pre or mini mock session are kind of pre-assessment for you to book your exam. And last but not least is the final exam. We have 17 grand mocks. So I'm gonna bet you that in this package, nobody is offering you this services, because I believe that nobody has such, nobody has such extensive team that M&M do have with our footprints from the last 7 years. We have been working in OET, helping a lot of students to pass their OET writing and speaking part. So we have walked the walk, we have constructed and worked in our team in OET department, and now as a family, we are working our students, either doctor or nurses, to get their OET done. So in the last, we can show you how things work at M&M in a quick review, and you will have an idea that how will you get the feedback services. Thank you very much, and stay tuned for the next video.